Hello, everyone. My name is Pam Franks, and I'm the walk coordinator for the GBS-CIDP Foundation. Joining me today is our Associate Director of Development, Maddie Miller. Hi, Maddie. Thanks for joining us.
Hi, Pam. So excited to be here today.
Thank you. Thanks for sharing co-host duties with me. We would both like to welcome you all to the first of our 2021 virtual walk wrap-up events, the GBS-CIDP Foundation International.
Due to the ongoing pandemic and COVID-19 restrictions that remain in place throughout the country, the decision was made to convert many of our in-person walks to virtual events. This year, we introduced celebration boxes. These fun boxes supply teams with everything they need to create their own virtual walk event with items such as balloons, sidewalk chalk, foundation yard signs, banners, and awareness bracelets, and of course, my favorite, cowbell. Higher level boxes also included walk t-shirts and additional party accessories. Going virtual and providing the celebration boxes allowed friends and families to still come together and celebrate, to raise awareness, fundraise, and to walk or roll in the safety of our own home, on vacation, and by the pool or local neighborhood. We can still come together to make a greater impact to help those living the challenges of GBS, CIDP, and their variants such as MMN. Today, during each of our city stops, we will showcase some of the events that walk teams have held during the summer months. We continue to need your support during these uncertain times, as COVID does not stop GBS and it will not stop us from supporting patients and their families. Today would not be possible without the support of our volunteers, sponsors, donors, and of course you. We thank you all so much for participating this morning and for helping to support this very worthy cause.
We also want to give a special thanks to our 2021 national sponsors, including Grifols, CSL Behring, Kedrion Biopharma, Pfizer, and Takeda, and also to our local sponsors, Soleo Health, CVS Pharmacy, Accredo, RDO Equipment, and Hirschbach. To learn more about our sponsors and how they help patients living with GBS, CIDP, and their variants such as MMN, please check out our virtual exhibit space located on our website.
Before we get our party started, let's check in with our Executive Director, Lisa Butler, as she has a message of the foundation and what we do for our patients and their families.
Hi, everyone. Welcome to the 2021 virtual walks. Whether you hosted a walk celebration in your town or just joining us today, thank you so much for being a part of our community. I'm Lisa Butler. I'm the Executive Director of the GBS-CIDP Foundation. We are celebrating over 40 years of serving patients so that no family has to ever go through this alone. We focus on providing support, education, we fund research, and we engage in advocacy. So are you a member of our foundation? If not, hop on over to the website, gbscidp.org, become a member, get connected to all of our amazing resources, centers of excellence, expert medical opinion, and most of all, patients and families just like you so that you can support and help each other. I also want to thank our amazing volunteer chairs, Crystal Sada in Staten Island, Dave Aherns in Chicago, Megan McCullough in Houston, Dee Gauss in Raleigh, Megan Comp in the Twin Cities, and Kristen Morgan in Pittsburgh. Thank you all so much for all you do for the foundation and for the community. And a huge shout out to the staff for bringing this together today, especially Pam Franks and Maddie Miller. Let's get walking. Thanks so much.
Thank you so much, Lisa, for joining us this afternoon.
Now, our first stop on our virtual trip across the country will be Pittsburgh, Pennsylvania. Maddie, did you know that the Big Mac was created in a suburb of Pittsburgh and first sold in 1967? They even have created a Big Mac museum that burger fans can visit, not burgers. And now let's check. Why not? Make it a party. And now let's check in with our walk chair and Pittsburgh liaison, Kristen Morgan. Good morning, Kristen. Thanks for joining us this morning.
Thanks, Pam and Maddie. It's great to join you too. And hello to all of our walkers out there. It is such an honor to be kicking off this year's virtual walk in Pittsburgh again. The Pittsburgh Walk and Roll was one of the first 3 inaugural fundraising walks, and it's brought so much joy to me each and every year to bring our small but mighty community together, whether we're in person or virtual. For anyone who is joining us for the first time, I have CIDP, and I've had it since I was 14 years old. It was a couple of years into my diagnosis before I had met anyone else like me when I attended my first symposium with the foundation. I was in college when I started organizing the first Pittsburgh Walk and Roll. So this event has grown and evolved right alongside me. I would like to thank my parents, husband, and the friends and family who have come out to walk with us each year, donated generously, collected aluminum cans, and helped with various aspects of the event, from taking photos to collecting all those donations and running the raffle. I would also like to give a special thank you to our longest local sponsor, Sterling Yoga and Wellness Center. Sterling has been getting us stretched out and ready to walk in Pittsburgh for 9 consecutive years. You will have the opportunity to stretch with us as well. Look for the link in the Zoom chat or check out the Foundation's YouTube channel to access the video. Sterling has put together a wonderful movement practice to help strengthen and protect the nervous system. You can do this 12-minute routine from either a sitting position or a standing position. As you can see on the screen, the only thing you need is a chair. In addition to being able to study with Sterling routinely, I have had the pleasure of organizing many other events with her over the years for GBS and CIDP awareness, including an annual health and wellness fair, teaching workshops about the nervous system, and doing paint and sip events to raise money for our team. Sterling has also kindly given me creative license to try new things, including teaching workshops about essential oils, painting cards with watercolors, and of course, my favorite, teaching dog-friendly yoga classes and fitness classes designed specifically for dogs. In the video, you can see Zuzu is doing something that is really great for her nervous system. So if you have a pet, you know that they provide you with a lot of comfort and support. So we can give that right back to them by doing exercises and treating them with that same compassion they give us. Look for Sterling and I again during the virtual summit in just a few weeks. And now, a few last announcements. Our top fundraiser is Kristen Schoenberger. She is a fundraiser extraordinaire. She's won this award several times now over the years. I've lost count. And our top team is Small Steps of Hope, Team Eli. His team also has the most members this year. Congratulations, Team Eli. You pulled ahead of Kristen Tropicals right at the last moment. And this year, our Pittsburgh Walkers have raised over $6,000. I also want to give one last thank you to the teams who have lost a family member or friend in the last year that was the core of their team and the whole reason that you walked. Thank you for continuing to support the Foundation's mission and research goals in your loved one's memory. Now, keep your fingers crossed, and hopefully we can all get together in 2022 to celebrate 10 years of walking and rolling right here in Pittsburgh. Thank you. Enjoy your walking. Be safe out there. And now for a message from one of our national sponsors.
Thank you so much, Kristen, for joining us this morning. And we completely agree with you. We cannot wait to be back in Pittsburgh to celebrate your 10th year. We invite you to check out Kristen and Sterling's full yoga exercise session on our YouTube channel. And like Pam posted, the link to the YouTube page is in the chat on the Zoom. Mm-hmm. Now we'd like to welcome our first national sponsor, CSL Behring. Joining us all the way from the Jersey Shore is Joel. And Joel, did you catch a lot of rays this summer?
I did, and I was at the beach yesterday, so lots of nice rays. It's always fun to go to the beach.
Great. Well, thank you so much for joining us today.
It's a pleasure to be here. Thank you for having myself and CSO Bearing. So my name is Joel Madievsky, and I am proud to represent CSO Bearing as a sponsor of this event. CSO Bearing is a global biotherapeutics leader driven by our promise to save lives. We meet patients' needs using the latest technologies to develop and deliver innovative biotherapies that are used to treat serious and rare conditions. We manufacture subcutaneous and intravenous therapies for the treatment of CIDP. For more information, please visit our website, hizentra.com and Privigen.com. We also operate CSO Plasma and rely on plasma donations to make our therapies. Visit csoplasma.com for a listing of our centers. And now back to you, Maddie and Pam.
Thank you so much, Joel, for joining us and for your continued support. To learn more about CSL and our other generous sponsors, don't forget to check out our virtual exhibit space located on our walk page under the virtual exhibit menu.
Thanks, Maddie. One of the reasons we walk is for research. The Foundation's research grant initiatives focus on diagnosis, treatments, and genetics. We now will hear a message from Chelsea Fix, the Foundation's Senior Manager of Research and Advocacy, who will talk to us about the importance of the Foundation's research grant program.
Hi, everyone, and thanks for joining us for our virtual walk and roll program for research. I'm here to tell you a little bit about how the Foundation supports research, and we want to thank you for all of your time and contributions because this would not be possible without you. So a little bit about our research program. One of the most important ways and most significant ways in which we get involved in research is by giving out research grants to GBS, CIDP, and variants. Number 2 is discovery awards. These are bigger awards. They span over 2 years, and they typically go to researchers who are a little more experienced in answering more complicated or more complex research questions. The idea is that these researchers studying a complicated research question can get their start on that project with our Discovery Award and then eventually get funded by a larger entity such as the NIH to continue that important work and keep making good discoveries. The last type of award that we give is the Benson Fellowship. We give this award every 3 years to one particular person with a very strong interest and strong research background in GBS or CIDP. And that person then becomes our Benson Fellow and does a very specific and complicated research project over 3 years that does help to better our understanding of GBS-CIDP. All of these awards typically fund basic research, and that's what we call lab science. It's the researcher at the lab looking at molecules and all of that important work that eventually helps us better understand treatment pathways or diagnosis pathways for GBS, CIDP, and variants. We also support other types of studies, sometimes called translational research, and that's really sometimes also referred to as bench to bedside research. So it's what's happening in the lab and what's happening in the field or at the clinic, and how those two ideas come together and mash. So we support IGOS, which is the International Guillain-Barré Outcome Study. And that's a long-term observational study, really looking at the natural history and natural progression of GBS in people who have had the condition. We also support INCBASE. It's another long-term observational study, and that is looking more specifically at CIDP and the natural history and natural progression of people living with CIDP. So those are our major ways of which we support research, and we could not do it without you. Thank you so much for being here, and we hope to see you again in the future.
Chelsea just explained how important the Foundation's research grant program is to those living with the challenges of GBS, CIDP, and their variants. The GBS-CIDP Foundation International believes in supporting research on GBS, CIDP, and their variants by funding grants for projects that contribute to the knowledge of and towards an eventual cure. To date, we have committed over $4 million towards basic and translational research. You can learn more about our research initiatives by visiting our website.
Great, Pam. Now let's pack our bags and head to our next destination on our tour, which is Staten Island, New York. Hey, Games of Thrones fans, did you know that writer George R.R. Martin modeled the map of Westeros after the shape of Staten Island? He lived across the Hudson on the New Jersey as a child and imagined what the island would look like. And now let's chat with someone who's as beautiful as the mother of dragons, our Staten Island walk chair and liaison, Crystal Sada. And Crystal, I hear we have congratulations as our other loyal volunteer, Jay, just graduated, just retired.
You know, it's funny. I keep saying graduated too, but in a way he did, right? I mean, he's graduating to the next stage of his life. So now he's going to harass me more, but that's okay.
Well, thank you so much for joining us today, Crystal.
Yes.
Of course. Anybody who doesn't know me, I'm Crystal Sada. I'm from Staten Island, New York. I am your walk chair. I will be speaking today off the cuff. I hope you bear with, and I hope that's okay with most of you. I find that works best for me. I want to thank the foundation for me this moment to speak with you and all the fellow Staten Islanders and New Yorkers who, quite frankly, recently have had it a little rough here. We had the remnants of Ida about a week and a half ago, and a lot of people still don't have power. They've lost their homes. And yesterday, as you all know, it was the 20th anniversary of September 11th. So this is quite a difficult weekend for most of us here in the Northeast. But saying all that said, Staten Islanders and New Yorkers are still coming through, and they're still donating. And even though there's been a lot of financial problems here, and with COVID as well, people have lost their jobs, the Staten Island Walk and Roll this year has raised a little more than $1,500, which may not sound a lot, but I will tell you, the last in-person walk and roll that we have had, we raised $30,000. That's what Staten Islanders are, and that's what New Yorkers are. We're there in a pinch. They're there to help you out. And because I have a big mouth, because I'm from New York, I harass people, and I think I make them feel guilty that they have to give. But for those of you who may not know, I am a CIDP patient. I got it in 2014. I was an athlete. I was running half marathons. I was working in pharma. I was back in college at night, and everything stopped. Everything stopped. This is why this is such a passion for me. And I am so dedicated to anybody who has GBS, CIDP, MMN, or the other variants. I just feel such a need to help out and bring awareness. Now, the wonderful thing this year, I haven't been able to go out much because I am on immunosuppressants because of my disease. So I have to be extremely careful. But thank goodness for Zoom. I've been speaking at a lot of pharmaceutical companies this year and participating in clinical trial questionnaires and patient advisory boards. And I will say, can't speak too much on it, but there's a lot of new treatments coming down, which is really exciting. So the future is looking so bright. I have to put my GBS-CIDP sunglasses on. That's how bright the future is. So we're very excited moving forward for everything that's happening. Again, Crystal's Crusaders, who was my team, has raised over $1,000. Thank you, everybody who's participated. Special shout out to Mary McLaughlin, who donated well over $250. I don't want to embarrass her, but thank you, Miss Mary, for your generosity, not just today, but all year round. What is the foundation to me is kindness. Right? That's all we have. You may not have money, you may not have the resources, but we're all kind to each other. And anybody in the foundation, if you know, we're all lovely, kind people. So what can we do? Maybe show a little kindness today. Donate what you can. Donate $10, $15, $20. It doesn't matter. Every penny, every dime counts. And in the beginning of this program, you heard from Joel from CSL Behring. Joel mentioned plasma donations. Without plasma, I'm not exaggerating, I would be paralyzed from my neck down. I use their product, Zentra, sub-Q, which means I administer it myself once a week, and it's the thing that saved my life. So please, if you cannot donate money, think about donating plasma. You can get on their website again, CSL website Bearing, okay? No, CSL Bearing website. Sorry, CIDP brain. But and perhaps donate plasma. That you're saving so many lives by doing that. So again, I just want to thank everybody for participating today and for joining us through this difficult year. It has been difficult, but you know what? We rise up and we make do, don't we? So thank you again to the foundation. Thank you to all the other walk chairs. Thank you for my dear husband who has graduated and supports me every day of my life. Where would I be without him? And thank you, Pam and Maddie, so much for hosting this today. So back to you guys. And remember, walk and donate. Thank you.
Thanks, Crystal. Crystal, that was a great point that you brought up, that people can do so much more than just donate their money. They can donate their plasma as well. We have a lot of our patient base relies on IVIG products. So again, we appreciate all that you do for the foundation. Now, next, we would like to introduce you to Jim Jones with Grifols to chat with us for a bit. Good afternoon, Jim. I was about ready to say good morning, but you know.
Hi, Maddie.
How
Hi,
are
Pam.
you? It's been like
well.
a year since we last did this.
I was just thinking it's been a long time since we've seen each other, so it's great to see you guys.
Yeah, same here.
Well, thank you so much for having me today. It's great to be here with you as you kick off this year's walk season. Grifols is a very proud sponsor of the GBS-CIDP Foundation, as we too care and support this community. Mike, do we have that banner that we could show along the bottom? I'll share that Grifols is the manufacturer of Gamunex-C, and Gamunex-C is the #1 prescribed IG for the treatment of CIDP. So very good chance that many of you are familiar with Gamunex-C. And I'm not really going to talk about treatment and therapies today. I really wanted to focus more on resources for you. And in my mind, Gamunexc.com down below here is one of the best resources we have. You can utilize Gamunex-C for information on tools, resources, and I think one of the most important things, financial support. We have information on patient assistance and also our copay assistance program. We're currently offering $2,500 per calendar year to help offset the cost of therapy. And all of that information can be found at Gamunexc.com. The second website I'd like to share with you is grifolsplasma.com. And you've heard it mentioned, there is a need for plasma donations. I would encourage you to share this website with your family, friends, loved ones, coworkers. There is a very real need for plasma donation. We are still well below the pandemic levels for donation. And that's really not a Grifols thing. That's a manufacturer. That's really across the board. So I would just encourage you to share that information. You can use that website to find the local donation center nearest you and to really make an impact and allow the manufacturers of IVIG to continue to provide therapies in the future. So with that, I'm just going to say thanks so much for having us. It's always great to be here. I look forward to catching you on the next one. Back to you, Pam and Maddie. Thank you.
Thanks so much, Jim, for joining us, and thank you and Grifols for your support. Remember, you can learn more about our sponsors, including Grifols, by checking out our virtual exhibit space located on our website. Just posted the link in the chat feature in our Zoom. And now, let's check in with our walk chair from Houston, Texas, Megan McCullough. Hi, Megan. Thanks for joining us this morning. Now, Megan, I have to ask, is it true that the residents of Houston eat out more times a week than anywhere else in the U.S.? Is that true?
Well, I can't speak to that statistic, but I can say I'm guilty of that for sure. Like, you support our local communities, and we definitely have the largest worldly cuisine around. Absolutely.
I was thinking it was maybe at least like the good barbecue, but I should say it's probably more so than that.
Yeah, we've actually been barbecue connoisseurs during the pandemic, trying all the places around town. It's been fun.
Nice.
Well, hi, everybody, and thank you, Pam and Maddie, for having me here today. Much like Crystal, I don't have, I'm going to go off script and talk to everybody. Houston, the Houston Walk and Roll has been going on for 6 years now, 7 years, and has evolved over the years, and wanted to kind of tell how I got involved. I am not a patient myself, but my mom was diagnosed with CIDP in 2014. And I struggled to try to find a way to help her and patients like her because it was such a struggle to find a diagnosis. And I had gotten a postcard in the mail from the GBS Foundation about a walk and roll happening in Dallas that year, and called them up and asked what I could do. When the Houston one was coming, and was told there wasn't one, and volunteered to be the Houston Walk Chair to make sure that I could bring the Houston community together to build a community of support locally for our members and for people like my mom. And since then, we have reached thousands of people who have attended our walks. We've raised nearly $50,000 over the course of the years. It's been really amazing, and the community support that's provided has been fantastic, and we really hope that we can get together soon. Houston has obviously been one of the hot spots around the nation during the pandemic, so it's been a struggle trying to maintain that sense of community. So I'm going to give a huge thank you to the foundation for finding ways to continue to support patients such as my mom and those in the community that are fighting the battle of GBS, CIDP, and variants like MMN. So thank you very much for keeping these virtual events going and that outreach that I love that y'all do. I want to give some shout outs to some teams and some walkers. Our big fundraiser so far this year has been Debbie Berg. Thank you so much for all your fundraising efforts. And some of our teams, I love the creative team names that everyone has come up with year after year. Our top team is the Griffles Texas Heat, raising good bit of money. We've got a team, Look Who's Walking Now, Team Gina, Rollout GBS, and the Stubborn Walkers. And then some other individual walkers who have registered. Give some shout outs to you guys. Denise Conkle, Alyssa Sneed, Alan Thierry, Chantry Conkle, Stephanie Pole, Balin Broadway. I've been speaking with you lately, so hi. And thank you to all of our national sponsors who make this possible for us and to continue treatments and therapies for the patients. So I'm glad you were able to join us once again. And thank you to all of the people who have registered to become part of the GBS. Without you, we wouldn't have a community nearby. So thank you for registering. And I hope everyone is able to get out to the local parks. It's been beautiful in the Houston area the last week. And hopefully you'll be able to enjoy the weather before the next storm comes around that's coming in this week. So everyone stay safe and enjoy the pretty weather we have right now and get out there and celebrate. Back to you, Pam and Maddie.
Thank you again, Megan, for joining us, and we appreciate all that you do for the foundation. Now we'd like to take a moment and share a message with you from one of our national sponsors, Takeda.
Good morning and good afternoon to everyone. My name is Costanza Barberis, and I am the Marketing Director for Neuroimmunology at Takeda. Takeda is a patient-focused, value-based, R&D-driven global pharmaceutical company dedicated to serving patients by providing innovative products that improve their lives with better healthcare. Takeda is committed to supporting patients worldwide across several therapeutic areas. Plasma-derived therapies represent one of Takeda's key areas of focus, and immunoglobulins are critical life-saving medicines that thousands of people with rare diseases rely on every day. Takeda has something unique, something we call patient trust reputation business. Patient trust reputation business is the framework that has sustained us for over 240 years and distinguishes Takeda from other pharma companies. It's what keeps us focused amidst uncertainty, as during this unprecedented COVID era, and ensures that our decision-making remains connected to what matters most, putting patients first, and doing it in a way that fosters trust, enhances our reputation, and creates a successful and sustainable business. We are very proud to be here with you today and to be able to support the GBS-CIDP Walk and Roll events, as well as the Foundation's other activities, as we strongly believe in the importance of continued research. At Takeda, we endeavor to develop methods that will help reduce time to diagnosis, offer the right treatment for the right patient, and support the scientific innovation in understanding rare disease physiopathology. Thank you for having us with you today, and we can't wait to walk and roll.
Thank you, Takeda, for your continued support. Don't forget to go to our website and learn more about all of our wonderful sponsors this afternoon. Check out our virtual exhibit space located on our Walk and Roll website. Next, let's pack our bags and head to the Windy City with our Chicago Walk Chair, Dave Ahrens. Thanks so much for joining us, Dave.
Hi, Dave.
Good morning or afternoon. Thank you, ladies. Good afternoon, everyone. My name is Dave Ahrens. I am your Chicago Walk and Roll Chair. It is a beautiful day here in Chicago, and I hope you're able to get outside for a walk today, even though we can't do so together. This is my second year as walk chair and second year that we've done it virtually. So I, more than nobody else in the world, hopes that we can finally gather and walk in 2022 for the first time for me ever. I was diagnosed with CIDP in August of 2018. Prior to that diagnosis, I had never heard of CIDP and frankly had really no idea what I was up against. As I was laying in my hospital bed, I started to research CIDP, and that led me to the GBS-CIDP Foundation's website, where I was able to really get to work learning and understanding what this condition was and how I was going to fight it. One of my favorite parts of the website is the patient stories section. Seeing other people's stories and how they took on their diagnosis was extremely helpful to me. I found inspiration in so many of these stories and really took to heart the concept of it's only rare until it's you. After my hospital stay, I was able to go home and begin adjusting to my new normal, but I never really accepted what that new normal was. I've been working hard, challenging myself, and meeting others facing this challenge. I found inspiration in them that helps drive me to keep going. Continue to be humbled by the help and support my friends, family, doctors, nurses, therapists, and even strangers give me each and every day. About a year after my diagnosis, I was able to go to a lecture at the University of Chicago, organized by Carrie Grimes and the GBS-CIDP Foundation. There I met others who were sharing my struggle, as well as representatives of the foundation. I learned so much in just a few hours and met some truly incredible people. When they asked for a volunteer to help coordinate the 2020 Chicago Walk and Roll, I was ready to put my 14 years of experience with charity bike rides to work. Wanted to start helping other people as much as I could. But I haven't done this alone. I want to thank the GBS-CIDP Foundation and this community for all their help over the years. In fact, just a couple weeks ago, I missed a couple calls from Maddie, and Pam reached out to me to make sure I was okay. This is a good community of people who really care about each other, and I'm honored to be a part of it. I'm also very excited to tell you about a new team in this year's walk, the Chicago Tough Turtles. They have been tearing up their fundraising. Jonathan Drog has raised over $1,000 alone, and the team has raised over $5,000 together. They're also gathering today for a 4-mile walk in Chicago. Way to go. I am impressed and humbled by that. I want to thank every member of my walk team, Never Tell Me the Odds, and all our donors. Every dollar helps people like myself and Jonathan. The Chicago Walk has raised nearly $7,000 so far this year, and I want to see that go higher. Let's keep it going. I would like to thank again all my friends and family across the country who are participating in the walk, those who have contributed to the cause, and especially those who have literally picked me up off the floor during my fight against CIDP. What we're doing today will help fund support for people like me, education for those providing care, and research towards treatment and hopefully a cure and a world without GBS-CIDP and their variants. I want to thank you all for your time and attention. Have a great walk today. And I look forward to seeing all of you in Chicago for the 2022 walk. Back to you, Maddie and Pam.
Quick before you go, our producer, Mike, kind of told us about your elaborate setup that you have for today. Your Jenga assembly.
Yes, it's, my grandfather was a road commissioner, and he frequently said, if you can't fix it, duck it. And my setup this year is roughly the same as last year with some different puzzle boxes.
Well,
yes,
looks like it
got a little
David
creative.
Jenga.
Well, thanks so much again, Dave. We really appreciate you taking the time to spend with us this afternoon.
Great to see you
Yes,
guys.
thank
Have a good
you.
one.
Bye-bye.
Next, we'd like you to introduce you to Steve Higgins with Kedrion Biopharma to chat for us a bit. Good afternoon, Steve. Thanks for joining us.
Hey everyone, how are you doing, Pam, Maddie?
Good, good. How about yourself?
Good to see you.
I'm doing great. Thank you so much for having me. And Dave, what an outstanding setup you have. It's amazing how we've all had to improvise and adapt in this Zoom world just to make it all work for us. For sure. But guys, I really appreciate the time. It's so exciting to be a part of this, and I appreciate the opportunity to talk with everybody. My name is Steve Higgins. I'm a territory manager with Kedrion Biopharma, and I'm based in Kansas City. Kedrion's been participating in the walk and roll events for quite a long time now, and it's always a very special time. So I'm grateful to have the opportunity, as I said, to participate. You may have heard about Kedrion Biopharma from events in the past. If not, I just wanted to touch on our company a little bit, just to give you a little idea of what we're about. We're a little different because we are a family-owned organization and run a little bit differently than some of the others. Here at Kedrion, we really have a relatively small footprint in the United States, but we are very passionate about what we do for our patients and those that we serve. You know, as I mentioned before, we're a little bit different. We're family owned. We have roots to go back many decades in Europe, but we've come a long way here in the United States. We've been in the U.S. for about 10 years now, and have been working with the GBS-CIDP Foundation for probably 5 or 6 of those, and it's been a fantastic experience. Our global headquarters is in Tuscany. In Tuscany, Italy, believe it or not. And of course, the first thing everyone asks me is if I've had a chance to visit the area and get out there. Unfortunately, I've not been invited to Italy as yet, but it's a beautiful shot. I've seen it as you do through the photographs, but this is a picture of one of our manufacturing facilities in the Lucca, Italy area. I just love the backdrop there. I hope to get there soon. I have been to our U.S. headquarters, which is based in Fort Lee, New Jersey, just across the George Washington Bridge there from Manhattan. Been there to that location a number of times. These are just a few pictures of some of our presence at previous walk and roll events. Whether they're live or virtual, we really enjoy the opportunity to support the community and to be able to participate in these events. Just a quick word about our product. And that's GammaKed. GammaKed is a 10% IVIG solution. As you can see on the slide, GammaKed has indications for primary immunodeficiency, ITP in adults and children, and also CIDP in adults. And we've been on the market for a number of years. with any of these products, Gamma-Ched, like all the others, does contain a box warning that relates to thrombosis and kidney dysfunction. So I would always encourage everyone, read your package insert, talk with your healthcare provider, and get the education that you need on these products. But that's the one that we have out on the market. Let me just, in the interest of time, I'm going to skip to the last one of my slides here. Just encourage you, if you want to learn a little bit more about Kedrion as an organization, just go to www.kedrion.com. Get a chance to learn a little bit more about how we came to the United States, a little bit about the family in Italy, as well as the portfolio of products in the disease states that we work with. So just another opportunity to learn about the company. So with that being said, I really want to thank the GBS-CIDP Foundation, Pam and Maddie, for having me on there. I really do appreciate it, and I'll go back to Pam and Maddie.
Thank you, Steve. We appreciate you too, and thank you for your support. Remember, you can learn more about our sponsors, including Kedrion, by checking out our virtual exhibit space located on our website. And now let's head to North Carolina, where the state vegetable is the sweet potato. And nothing is as sweet as our Raleigh Walk Chair and Liaison, Dee Gauss. Hi, Dee. Thanks for joining us this morning. Now,
hi, how are you ladies?
Good.
Great.
So you are an event planner. It must have been a very challenging past 18 months or more for you. Has it been crazy?
Yes, it's like a seesaw. You know, it has its ups and its downs, and then somebody jumps off. And then we get back going and go up and down again. But, you know, we're hanging in there, and we're all looking forward to being back in person full time again. Well, hello, everybody. I just thank you so much for being here for this walk and roll. I am so thankful for the GBS-CIDP Foundation. I am Dee Gauss. I am the Raleigh Liaison and Walk Chair for Raleigh. The foundation has been such a blessing to our family when my husband was diagnosed back in 2015 with CIDP, and we didn't know what that was at the time. And the only real information we received was Googling the condition and finding the GBS-CIDP Foundation at the very top. And that really, really saved our lives in a lot of ways. And it is that commitment to research that actually made a difference for us and for my husband. I'm so thankful that Estelle had the wherewithal to put this together. I don't know where our lives would be without it. And we're thankful for everyone that gives for research. My husband is a CIDP patient. He, again, was diagnosed in 2015. He went through the whole gamut of having plasmapheresis and IVIG and kind of going up and down the spectrum. And then finally, he is taking sub-Q, and that has changed his life tremendously. My husband went from a wheelchair, not able to pull his body out of a chair at all. And now he's able to walk mostly without a cane these days. And that's due to research. And those of you that give, research is not free, and you guys give and you make a difference in the lives of all of us. So I want to thank you guys so much for that. I want to thank my top teams, which are the Stumbleweeds and the No Fight All Warriors for giving. Thank you so much. And for Rose and Tiffany, who are our top givers, you're making a difference. And if you're on this walk and roll call today, just because we end this call today and this virtual walk and roll today doesn't mean you need to stop giving and supporting the GBS-CIDP Foundation. But we're so thankful for you. And I'm so thankful for Meg and Pam, and I want to send it back to you. Thank you so much.
Thanks for actually using the beads and the pom-poms that you got in your celebration box. Thank you.
Welcome. Well, thank you, Dee, again for joining us, and we appreciate all that you and your husband Arthur do for the foundation. We want to now move on to a message from one of our new national sponsors, Pfizer.
At a time when things are most uncertain, we turn to the most certain thing there is: science. Science can overcome diseases, create cures, and yes, beat pandemics. It has before. It will again. Because when it's faced with a new opponent, it doesn't back down. It revs up, asking questions till it finds what it's looking for. That's the power of science. So we're taking our science and unleashing it. Our research, experts, and resources, all in an effort to advance potential therapies and vaccines. Other companies and academic institutions are doing the same. The entire global scientific community is working together to beat this thing. And we're using science to help make it happen. Because when science wins, we all win.
Thank you, Pfizer, and thanks again to all the support that we receive from our national sponsors. And just a reminder, you can learn about any of our sponsors this afternoon by visiting our virtual exhibit space located on our WALK website.
Our final stop on our city tour this afternoon is Twin Cities, Minnesota. Joining us is WALK Chair Liaison Megan Comp, along with WALK volunteer Heather Jackson and her son Henry, with an important message.
Good morning, everyone. Welcome to the Twin Cities of Minneapolis and St. Paul. My name is Megan Comp.
I'm Heather Jackson.
I'm Henry Jackson.
And we are sitting here on the shores of Lake Minnetonka this morning, enjoying a cooler morning and some cooler temps after a very long hot humid summer. So we wanted to start things out this morning by having Henry Jackson tell you a little bit about his story.
Hi, I'm Henry. I'm 15, and when I was 2.5 years old, I was diagnosed with GBS, which is a disease that can hit anybody at any age. Luckily, I don't remember most of it, but I was in the hospital for weeks, and it took years of physical therapy to regain my full strength and mobility. While I was in the hospital, I was paralyzed from the chest down, and I was unable to sit up or move. Luckily, I got diagnosed fast, because without a fast diagnosis, my condition would have lasted even longer. I am here today to not only raise money, but also awareness, because fast diagnosis and proper treatment are the keys to recovery, and I am living proof of that. Any donations are greatly appreciated.
I am Heather. Like I said earlier, I walked for my son Henry, for my sister-in-law Rose, for Megan's daughter Jane, and for the thousands of families that are afflicted by GBS-CIDP and its variants. I walked to create a community for those families and to offer hope in the face of a devastating diagnosis. Our fundraising efforts have been thwarted by the pandemic in the last year. However, our commitment to raising awareness has not. We raise money to fund scientific innovation, which offers faster diagnosis and more effective treatments, the very things that saved my son's life and countless others. We are grateful for those of you that join us in our commitment to raising awareness and funding the support necessary work of the GBS-CIDP Foundation. I hope you will consider making a donation today. No amount is too small, and any amount is appreciated. Thank you so much.
So I'm Megan again, and my daughter Jane was diagnosed with GBS in 2015 when she was 15 years old. She started out with an ordinary cold, what we thought was an ordinary cold, and soon got to learn more about GBS and the devastation that it can wreak. She was paralyzed from her toes to her shoulders. She was in ICU for 5.5 weeks. She was intubated, tracheostomy, and in excruciating pain. So she was one of the lucky ones. After 6 weeks of inpatient rehab at Gillette in St. Paul, she was able to walk out on her own. But I realized there was something in me that changed when I saw my daughter go through this. And I realized this is something that I wanted to get involved with and in any way that I could. So in the fall of 2016, I became a liaison for the GBS-CIDP Foundation. And when I did some training out in Philadelphia, it was fall of 2018, that's when I was introduced to the walk and roll events. And I realized that this is something that we needed to do here in the Twin Cities. we had our first, I guess it was fall 2017, fall, it was 2018 when we had our first walk. And I remember them telling me that you should expect maybe 30 to 40 people at your first walk. And we had a small little shelter that was rented at Battle Creek Park in St. Paul. And was supposed to accommodate 75 people or so. We had 175 people show up for our first walk, and we raised over $26,000. It was absolutely just an incredible day, and I realized that this is something that people wanted. They wanted to form this community of people who understand what GBS and CIDP and their variants are like, and who wanted to connect with one another. So that was an amazing day. It was more than I ever could have imagined, ever could have hoped for. And so then we commenced organizing the 2019 walk. We moved to a larger location at the same park, and we had about 275 people show up, and we raised $32,000 that time. So anyway, unfortunately, that was our last in-person walk. COVID had other plans for us, but anyway, we kind of just had to adapt, and we've gone virtual, and we're happy to be here with you today. And we're really grateful for the supporters that we have had that have really kept this movement going. It's tough during the pandemic. People kind of back off on things, and they're not front and center, and they don't have an event to attend. But I wanted to kind of personally thank someone that I've known for many years, and she has taken this on as her cause as well too. And her name is Katie Davis, and Katie works for a company called RDO Equipment, and RDO has this great program where every employee is given $250 to donate to a charity of their choice. No questions asked, $250. And Katie immediately said, when I told her about it, she said, "Oh, I can give you my $250. And I didn't know anything about this. I didn't know what this was all about. Anyway, since then, she has gone on every year, and she's recruited more people from her company to donate. In addition to, and there's an additional $1,000 last year. But this year she has, besides herself, she has recruited 10 other people to donate their $250. So she has raised right now $2,750 toward our event, and she calls this our cause, which means the world to me, because this is so important to me. It's so important to us, and so many people don't understand how devastating this can be and life-changing. So I want to give a shout out to Katie and all of our supporters who have been with us, the friends and family that year after year, when we plug them for donations, and they donate money every year, knowing how much this means to us. So I want to just say thank you so much for everyone for being with us here this morning on this gorgeous day. I hope you enjoy the rest of the presentation, and hope to see you all at the virtual summit in October. Take care.
Take care. Thank you.
Back to you, Pam.
Thank you, Megan, Heather, and Henry, for that wonderful message. We appreciate all that you all do for the foundation. We've had such a wonderful time going around the country to meet our amazing walk chairs. These walk chairs have taken the time to plan walks that raise money for groundbreaking research. Today, with the help of you, our walk chairs and volunteers, we have raised, drumroll please, 57, more cowbell, $57,000 peer-to-peer fundraising to date. Thank you so much.
That's fantastic. Even though the pandemic and COVID restrictions continue, we still have so much going on here at the foundation. Stay abreast of all the latest news and events from the community, like on our events calendar on our website. And under support, you'll see all of our upcoming events, including our 2-day virtual summit.
Thank you again to all of our participants, our sponsors, and our staff for joining us this afternoon. Thank you to my fellow co-host, Maddie. I was trying to cut it short, wasn't I? We have one more guest. That's totally my bad. Joining us is right now, and I am so very sorry. It's just Lovejoy from Soleo. Best for last. Hi, Jeff.
No worries. No worries.
You took the time out of your day to join us, and we tried to give you the shaft. I am so sorry.
Well, I've just had such a wonderful time watching all of this. And, the thing that strikes me the most is whether this is happening virtually or if it were to happen in person. getting to see the community that, bands together for the CIDP and GBS patients and beyond. I heard it mentioned several times, which I love to hear, the variations of CIDP and the other ways that it can present itself. There's so many different atypical presentations for these different cases that patients experience. And so I think it's very important to be aware of those facts. But a little bit of background, Solio Health is a specialty pharmacy at its core, but we do so much more than that. And I think the biggest piece that I'd like to emphasize, and a personal core value for myself as well, having worked in the infusion world and the neurology world for the last 11 years, is that we really prioritize being partners to the patient in their journey from their disease onset, symptoms, all the different medications that can be prescribed leading up to potentially immunosuppressive drugs or IVIG that's been mentioned, obviously, and a lot of patients I'm sure are currently on. It's making sure that we are there to help advocate for getting the patients on the appropriate therapy and providing access to that treatment. So it really stems in so many different ways. We have patient advocates who are living with CIDP or other neuromuscular or autoimmune conditions that are working with Solio to provide that real world insight and provide guidance so that if patients are referred to our company, they have a voice, they have somebody to speak with and really help understand what it is that they're going through and what to anticipate as they're, pursuing new treatments and whatnot. Beyond that too, we're also providing so many resources as far as insurance support goes. Many patients, I'm sure, can relate to this, that their insurance companies have denied them for IVIG in particular. So really working with physicians to make sure that the appropriate documentation is always assembled so that we can really paint the picture of, again, that journey of how did the disease onset begin? What were the symptoms? How did we get to IVIG in this case? And making sure that if a patient is denied, that we're helping provide all the clinical rationale, data, and support to the physicians so that they can successfully appeal those denials. It's such an important piece of this to make sure that patients who start therapy can stay on therapy and that it's guaranteed to be paid for by the insurance companies. Beyond that, though, too, we're always aligning the copay assistance programs that you've heard mentioned from Grifols and from Takeda and from CSL Behring, Kedrion, any of the manufacturers that we partner with, again, making sure that we're providing patients with the real-time insights with the physicians, always making sure that they're aware of what these programs are too, so that everybody within this community knows what those resources look like. And then beyond that too, looking at other programs and other foundations that can provide levels of patient support. That's a big piece of what we're doing. Beyond that, though, too, again, with that partnership notion, is we work with providers directly, with doctors directly, to really make sure that we're empowering them and providing them with the clinical insights and the educational opportunities to think about new approaches, working with manufacturers that have new drugs coming to market and making sure that doctors understand what all the different dynamics are that revolve around those different treatments and the different mechanisms of action. There's so many opportunities for us to take a big stance in making sure that doctors are empowered to really treat patients the best way they can. And the final piece of this is just the core of patient care. We want to make sure that we're looking at the entire holistic aspect of the journey that we, again, go back to, that everything is being touched upon, that we're making sure that all the dots are connected and that the patients are, again, getting onto the treatment that helps change their life. Hearing about these different stories, I can think of one in particular, having had a lot of involvement with different patient cases where a physician that was diagnosed with CIDP herself had to stop practicing medicine for quite a long time, and being able to help get her onto IVIG and being part of her care and the treatment plan that she was on. And throughout the course of several months, she was able to regain the ability to walk and be able to get back into medical practice again and really get back to what she could do so well. And so stories like that are what make this real and what make it personal for me and for so many of my colleagues that I get to work with to help be part of, again, this community and providing every ounce of support that we can. I think there's a banner with our website if there's ever interest or questions or difficulties in terms of getting IG approved or other therapies approved through the insurance company. I would encourage you to reach out to Solio. Mike, I believe there was a banner with our website there at soliohealth.com. You can certainly find all the different avenues of resources that we have gone down to provide and make sure that you have everything needed so that you can have the best life you can possibly live. So we're so thankful to be able to sponsor this event and look forward to much more to come. And Pam and Maddie, thank you so much for allowing me the time to speak with you all.
Yes, and thank you for doing that. I kind of like to talk a little bit, so I apologize that we completely went over your segment.
No, it's okay. It's okay.
We'll have to definitely make sure we send you a celebration box as a consolation prize for today.
With a
I'll ring
countdown.
that bell proudly.
Yes. All right, so let's try this again. Again, just want to thank all of our participants today, our sponsors, our staff for joining us. Again, to my fellow co-host, Maddie, your continued support for research is helping GBS and CIDP patients across the globe. Now go outdoors and have your own walk and roll. And hopefully, fingers crossed, like many of our walk chairs were saying, we get to walk and roll with everyone in person next year. Thanks, everyone.
Bye. Thank you.